And today I'll be answering your...
As I was saying, I'm here to answer your questions, anything you might have.
I'm Dr. Hammaad Gamieldien, and I'm an orthopedic spinal surgeon. I practice within Melomed Hospitals at Mitchell's Plain, Gatesville and Takai. I am 36 years old and I am married with 2 boys. I enjoy sports, I enjoy working, I enjoy dealing with my patients, and I ultimately enjoy coming to work every day.
What is your earliest memory of wanting to study medicine?
Probably when I finished school. I didn't have any dreams or aspirations of becoming a doctor at school.
Oh.
And then I took a gap year after school for a year. I went away for a little bit, did some traveling and some studying. And eventually I decided to do medicine because I didn't enjoy arithmetic or those kinds of sciences. And I enjoyed working with people, it was quite hands-on. And I like working with things, so I like being active, I don't enjoy sitting for long periods of time. So medicine offered that as an opportunity to be involved and to do a little bit more than just be at the desk.
After years and years of studying medicine, that is already a grueling experience, especially as a South African. What prompted you to then become a specialist?
So, I really enjoy working with kids, right? So pediatrics was one thing I was thinking about. However, you don't get to do too much with your hands with pediatrics. And while doing my internship at Victoria Hospital, I was actually really inspired by the consultant who worked there. And he gave me the opportunity to take part in the orthopedic theatre, and that really sparked my interest in orthopedics.
What drew you to Melomed?
I'm quite aligned with their philosophy in terms of how they are quite involved with the communities in Cape Town that generally don't have the access to expert healthcare that other communities have had historically. So I feel that coming into this group gives me an opportunity to work with people who would perhaps not have that access to a level of healthcare that they would need.
How would one know to visit a specialist like yourself?
So generally before you come and see me, you'll either see a nurse practitioner or you'll see a GP within your area or family GP that you've always been going to, and they'll identify an issue and then they'll send you to me. Generally with things like back and neck pain, and those kinds of pain sort of refer down the arms or the legs, that's specifically for spines, and then for any sort of musculoskeletal issues.
How long is the journey of needing spinal surgery from a referral or diagnosis to the procedure to the recovery?
Of course, like everything in medicine, it depends. I really like the use of the word journey, okay, because that's exactly what it is. And journey because the one participating in that journey is the patient. And essentially, if you do become one of my patients, or if you do undergo spinal surgery, you will most likely have a relationship with that doctor for a very, very long time. Not because of anything bad, but just because we as surgeons like to follow up our patients, because our whole aim and goal of operating or treating you is to restore you back to your level of functioning that you had before. And it's quite fulfilling for us to see that you've then achieved that same level of functioning and you are doing what you're doing and you're happy doing it. And that really gives us lots of satisfaction.
What trait have you acquired through studying and practicing medicine that you would like to pass on to your children?
Okay, so the biggest one really I think is resilience and a thick skin. I think it's really important. And
what was the most interesting case that you scrubbed in for, and what kind of impact has it had on you?
So I must say there are a couple of cases, and most of them would actually be pediatric cases. So for me, I really enjoy scoliosis, so spinal deformity. Most of those cases are in kids. And again, it's not really within the surgery where it's impacted me a lot. It's actually post-operatively, where you see the patient, usually young girls, and they look at you with that smile on their face as if to say, you know, you've like changed my whole world. And a lot of those girls come in and they're embarrassed to wear maybe like a vest or go to the beach or play sport. And now you've just given them that opportunity to be a little bit more confident. There's other kids that maybe aren't able to speak for themselves because of the conditions they have, but just the gratitude shown by the parents and the whole family that they've really been on a long journey with all the difficulty caring for this kid, and now you've just made things a little bit easier for them.
What is the most essential trait for a spinal surgeon to possess?
That's an interesting question. I mean, we actually talk about this a lot in theatre between the anaesthetist and the surgeon. Probably confidence in your ability, but also knowing your limits and being confident as to how far you can push yourself. I think that's me.
What is the last book you read?
The last book I read is probably Lord of the Rings.
Did you read the whole thing?
All of them. I read the whole thing, the songs, the stories, the side quests, everything in Lord of the Rings I'll read. Yeah.
What do you miss most about being a student?
Having people do things for you. Like activities, for example. So I mean, if there are seminars to attend or classes to attend, I mean those classes are organized, the seminars are organized. You don't have to give any input. Nobody asks you what content should we use. You come there, you sit down, and things are done.
If you could have dinner with anyone living or dead, who would you and why?
One, like, undoubtedly is Professor Alessandro. Like, undoubtedly. And then secondly, I would have to say somebody that I've sort of always admired, just because of like many things, something I've like grown up with, is probably Cristiano Ronaldo.
Spinal surgery myths. Number one, you can never be active again.
Yeah, that's probably the biggest myth ever. The whole point of the surgery is for you to get back to what you were doing before. There may be limitations in certain cases, but that's not the norm. So the norm is to restore your function. And in fact, 90% of my patients, or could possibly be even more, immediately the day after your surgery, you're up and walking around. There's no downtime, unless it's limited by the pain you're experiencing, but otherwise, functionally, your job is to get up and move and get going as soon as possible.
Spine surgeries are exactly the same regardless of the underlying causes.
No, we'll bust that myth. Many different ways to treat many different problems. Each treatment option is tailor-made specific to that patient. It's definitely not a cookie cutter speciality.
What gets you out of bed in the morning?
Work. Work gets me out of bed in the morning. There's never a day I wake up and like, I don't feel like going to work.